Rakan KKM, will Malaysia's new scheme overburden medical staff? The recent announcement by Malaysia's Ministry of Health, MOH, to roll out new initiatives, particularly concerning the Rakan KKM program and allowances for gazetted specialists, has stirred a significant debate in the medical community. But here's where it gets controversial. We're not addressing the real issue at hand, the critical need to increase the number of medical staff to match the demands of the medical field. While pay upgrades and technological advancements are essential, they are not enough. The MOH seems to be barking up the wrong tree. Take the Rakan KKM program, for instance. While it promises rewards for focusing on paying patients, this could lead to a concerning shift in focus away from non-paying patients. This is a primary reason why many doctors are leaving for the private sector, lured by the promise of better pay. But here's the twist: will the MOH build new private wings and recruit more staff to handle the increased demand? Or will the current workforce, already stretched thin, be asked to manage even more patients, paying or not? And what about the allowance for gazetted specialists? Is this just a rebranding of existing policies, with the only difference being the timing of the payment? There's no additional allowance given to these specialists. This raises the question, what's the logic behind these recycled ideas that do not address the current challenges? Perhaps it's time to take a bold step and focus on what really matters, increasing manpower and offering competitive salaries to attract and retain healthcare workers. Otherwise, we risk losing more doctors to other opportunities. To tackle this critical issue, we need a dynamic task force that can come up with viable solutions before the situation spirals out of control. Dr Nagarajan T, Vellasamy, retired consultant general surgeon, offers this perspective. But what do you think? Is this a step in the right direction or a missed opportunity? Share your thoughts in the comments. *, this is the personal opinion of the writer and does not necessarily represent the views of Code Blue. Don't privatize public healthcare, Part 1. Sosialis Malaysia's stand. Don't let privatization undermine our public healthcare system. A call to action by Privatize. We're facing a critical moment in the fight to protect Malaysia's public healthcare system. The recent statements by Bukit Gasing State Assemblyman Rajiv Rishyakaran, while seemingly progressive in his political leanings, are dangerously flirting with the privatization of healthcare services. This is a move that could have devastating consequences for millions of Malaysians, especially the most vulnerable. At first glance, Rajiv's support for market-driven solutions might seem like a practical approach to addressing the challenges in our public healthcare system. But let's not be fooled by the euphemisms. Terms like premium services, value-based care, and co-pay models are just sugar-coated ways of saying privatization, which will only deepen the inequality in healthcare access. These so-called solutions don't tackle the real issue: chronic underfunding by the state. This narrative of helplessness is misleading. It suggests that privatization is the only way to save our deteriorating public healthcare system. But that's simply not true. Privatization is not a solution, it's a betrayal of the public trust. It will only lead to higher costs, lower quality of care, and a widening gap between the rich and the poor. The warnings have been there for years. But the cries for help from our overworked healthcare professionals have fallen on deaf ears. As a result, many have left for better opportunities in private hospitals or abroad, exacerbating the shortage of healthcare workers in our public system. This is a recipe for disaster, especially as our population ages and grows. The Malaysian Madani government and future administrations must address the looming healthcare collapse without resorting to neoliberal policies. The projected need for 114,187 doctors by 2030 is daunting, but it's not insurmountable. We need to invest in our public healthcare system, not abandon it. Public healthcare is not a business, it's a fundamental human right. We must protect it from the logic of the market. Introducing premium economy or fee-for-service care in public hospitals would create a two-tier system, where access to quality care depends on your income level. This is unacceptable. We must ensure universal access to healthcare, not abandon those who need it most. Privatization won't solve the burnout crisis among our healthcare professionals. In fact, it could make things worse. Fee-paying systems and insurance models don't address the root issues of inadequate staffing, under-resourced facilities, and insufficient funding. Moreover, they create conflicts of interest and undermine the morale of public healthcare workers. The proposal to allow deductions from the Employees' Provident Fund (EPF) for medical insurance is reckless. It's presented as a solution, but it's a financial burden in disguise. With over 90% of EPF members under 30 lacking sufficient savings for retirement, this move could push families into further instability. What's missing in this debate is the political will to tax the ultra-rich. Malaysia is not a poor country. We have the resources to fund a just, universal, and effective public healthcare system. But we need the courage to redistribute wealth and prioritize the needs of the people over the interests of the market. Let's be clear, privatizing healthcare, whether openly or covertly, is a betrayal of the public trust. It deepens inequality, undermines public institutions, and abandons the dignity and care of all Malaysians, regardless of income. We must reject this quiet transition toward a market-based healthcare system and demand that our government invest in our public healthcare system, staff hospitals adequately, and make the rich pay their fair share. Join me in standing up for our public healthcare system. It's not just a playground for privatization experiments, it's the foundation of a healthy, equitable society. Let's protect it for generations to come. Bharati Selvam is a member of Part 1 Sosialis Malaysia, PSM, Petaling Jaya. Rakan KKM, the moral dilemma and economic impact on public healthcare. *** A bold perspective on Rakan KKM's ethical quandary ***. In a recent discussion that has stirred quite a bit of debate, Rajiv Rishyakaran, the State Assemblyman for Bukit Gasing, has shed light on the controversial implications of the Rakan KKM initiative. He argues that while it may introduce some level of inequality, the overarching goal of enhancing public healthcare funding justifies its existence. During an episode of the podcast, Are We OK?, aired last Friday, Rajiv, alongside co-host Peter Yong, candidly acknowledged that Rakan KKM could lead to a situation where paying patients receive expedited treatment, potentially disadvantaging those who rely on public services. It presents a moral conundrum, he stated. The ideal scenario would be for everyone to be treated equally, without the existence of separate queues for private and public patients. This reflects a somewhat socialist ideology that I personally align with. I believe in a system where all patients, regardless of their financial status, share the same line for treatment. However, Rajiv emphasized the harsh reality that without adequate funding for public healthcare, the system as a whole suffers. If we lack the financial resources to maintain hospitals and provide necessary services, it ultimately harms everyone involved. Therefore, I hope that Rakan KKM is implemented effectively, generating revenue that is utilized judiciously. He voiced concerns that the introduction of private wings in government hospitals could inadvertently extend waiting times for public patients seeking surgeries or follow-up appointments, as Rakan KKM relies on the same pool of healthcare professionals already employed in the public sector. If you have insurance or the means to pay, you can bypass the queue and access Rakan KKM services. However, it's important to note that the same doctors and nurses will be serving both paying and non-paying patients, Rajiv explained. Despite these concerns, he pointed out that the profits generated from Rakan KKM could be reinvested into purchasing essential medical equipment, such as MRI machines, which would benefit both public and private patients. Additionally, he highlighted the potential for improving healthcare professionals' salaries to retain talent within the system. Given the current dire circumstances, we could greatly benefit from the financial boost that Rakan KKM could provide, Rajiv remarked. I'm not fundamentally opposed to the idea, but I am keen to see how the generated funds are allocated. The specifics are crucial. There is a glimmer of hope that this initiative could yield positive outcomes. Rajiv also noted that while some patients might transition from public to private queues, Rakan KKM could attract new patients from traditional private hospitals seeking more affordable options within the Ministry of Health's MOH framework. He stressed that the primary aim of Rakan KKM should be to increase the ratio of paying patients compared to those receiving subsidies. For instance, if currently 1/3 of patients are in the private sector and 2/3 in the public system, Rakan KKM should strive to elevate the proportion of paying patients to half of the total patient population in Malaysia. If the ratio remains unchanged, Rakan KKM will merely shift existing patients from private hospitals, leading to an unsustainable workload for healthcare workers in government facilities, Rajiv cautioned. The broader vision must focus on converting subsidized patients into paying ones. He advocated for enhanced health insurance coverage across Malaysia, suggesting that insurance companies should be mandated to cover individuals with pre-existing conditions, including non-communicable diseases, NCDs, like obesity, akin to the provisions of Obamacare in the United States. Our Ministry of Finance should intervene to ensure that insurance is accessible to everyone, allowing those willing to pay but unable to secure coverage to obtain insurance, Rajiv, who represents a predominantly upper-middle-class constituency in Selangor, asserted. It's time we prioritize medical insurance. When discussing subsidies, we should focus on assisting lower-income individuals to afford medical insurance. While the M40 and T20 groups may not require subsidies, the lower-income population certainly does. Countries like Singapore and the United States have demonstrated that it is feasible to implement such systems effectively. When Young proposed the idea of utilizing Account 2 of the Employees' Provident Fund, EPF, retirement savings to purchase medical insurance, Rajiv responded enthusiastically, "Why not?" Although there is a diverse range of health insurance plans available, from basic to more comprehensive options, Rajiv suggested the introduction of a two-tier pricing model in medical insurance. He explained that higher premiums should grant policyholders access to more expensive hospitals, while lower premiums could be designated for more affordable healthcare facilities. Rakan KKM is likely to be more cost-effective than a luxury private hospital, so the premiums should reflect that, he noted. In a follow-up conversation with Code Blue, Rajiv urged Health Minister Zulkifli Ahmed, the MOH, and the CEO of Rakan KKM to hold comprehensive briefings about the initiative for members of parliament, state assembly members, and the public through open town hall meetings. Recent reports from Code Blue indicated that Rakan KKM SDN BHD aims to maximize profits by leveraging public resources, such as medical supplies and assets from the MOH, while charging paying patients a significant markup for these services. ***A closer look at financial viability****. According to the Auditor General's 2017 report, an extensive audit of the MO's full-paying patient (FPP) scheme revealed that 10 FPP hospitals generated a total revenue of only RM 20.3 million in 2017. This figure included RM 11.12 million paid to specialist doctors and RM 9.16 million allocated to the government. This revenue was recorded in the 10th year of the FPP scheme, which commenced in 2007 and expanded to 10 hospitals between 2015 and 2016. The average revenue generated for the government from these 10 hospitals was merely RM 916,000 each. If Rakan KKM SDN BHD aims for a net profit of RM 1 million per hospital in its inaugural year, it must generate revenue ranging from RM 5 million to RM 10 million per hospital, depending on a profit margin of either 20% or 10%. The initiative is set to launch in 4 hospitals during its pilot phase. Achieving RM 5 million to RM 10 million in revenue per Rakan KKM hospital would represent a staggering increase of 150% to 400% compared to the average total revenue of RM 2 million per FPP hospital in 2017. To illustrate Rajiv's point about Rakan KKM potentially acquiring MRI machines, it's worth noting that University Putra Malaysia, UPM, which manages Sultan Abdul Aziz Shah Hospital, HSAAS, invested RM 12.9 million in a 3 Tesla Prisma MRI machine, as reported last month. Even the financial performance of KPJ Healthcare Berhad, which operates 29 hospitals in Malaysia and has over 3,800 ward beds, cannot rival the annual budgets of the MOH. Last year, this private hospital group reported an annual revenue of RM 3.92 billion and a net profit of RM 407 million, which is less than 1% of the MO's RM 45.3 billion budget for the current year.